Hello, everybody. So the placement that I'll be talking about today and the characteristics of within the organizational structure is actually the place where I work. I work within a modified therapeutic community which concentrates on cognitive behavioral therapy to bring about change in persons addicted to alcohol, drugs, and the criminal lifestyle. It's a very different type of organizational culture. It is cognitive behavioral therapy, but it's also within a modified therapeutic community. The reason for the term modified is because it's located within a prison environment. Being that it's within a prison environment, it affects the culture twofold. It affects the therapeutic side. It also has some drawbacks to overcome for us as individuals who work within the field. The therapeutic relationship is at risk due to the clients being convicted felons. This adds to an ethical line that the therapist they need to have clear lines drawn. And obviously that's typical in life, but within a prison it's even more crucial that you have to have these lines set in stone, and you can't move around on these lines. There are many dangers associated with working in a prison. I'm not going to go too much in depth in that. You can kind of think about that in TV shows that you've seen. The second part of the culture, which can be difficult for the individual working within the environment, is the culture of the officers. Being that it's a law enforcement culture, basically once you're behind those bars, if you're not wearing prison clothes, you're part of a brotherhood. And this brotherhood, unfortunately, it's kind of a us against them type brotherhood. And as a therapist working within that environment, you can't have the us against them. It's not possible at all. And when you're working around officers that some of them just don't understand that you're there for therapy reasons, and they're less open-minded, I guess you could say. They don't see a difference. They have that us against them mentality. These people have a hard time seeing the benefits of therapy within a correctional environment. So it's up to people like me and others in my field to blend these lines and create a more workable environment between the therapy staff or the drug treatment staff and the regular officers. These were just a couple little things within the culture of trying to work a modified therapeutic community within a prison. And like I said, the culture itself is difficult. So you have to come to work ready and open-minded and willing to take on the difficulties of working within that environment. Thank you, and I look forward to hearing your feedback.